So good afternoon, everyone. Thank you for joining us today for our Health Equity Work Group. Chelsea Andrews and I are the site engagement coordinators for MVC, and we look forward to facilitating this work group for you today. In recognition of Pride Month, today's Health Equity Work Group will feature a presentation by Thomas Pierce, Director of Diversity, Equity, and Inclusion Development at University of Health Michigan West. Thomas has spent his career in advocacy roles, working to ensure that groups who have historically been victims of inequity are given the resources they need to be healthy and empowered to challenge oppressive systems. Thomas spent 5 years as the Director of Children's Residential Services, guiding clinical and direct care staff on therapeutic techniques for building trauma-informed relationships with children and adolescents. Thomas was the Executive Director of the Grand Rapids LGBTQIA+ Community Center, facilitating the expansion of preventative medical and behavioral health services for LGBTQIA+ individuals, and also acting as an advocate for local housing and civil rights policy change. In October 2020, Thomas joined the Department of Diversity, Equity, and Inclusion of University of Michigan Health West, and works as the Head of DEI Development, where he oversees DEI operations and programming, including learning and development, employee resources, as well as internal departmental outreach and some community partnerships. Thank you, Thomas, for joining us today for this work group. Before you begin your presentation, I just have a few housekeeping items to review. First, this session is being recorded. The slides and the recording will be shared with the attendees following the work group. Secondly, we will be monitoring the chat throughout the presentation, so feel free to add questions there. We also will have some designated Q&A time at the end of Thomas's presentation. Lastly, your feedback is very important to us, so if you could please complete the post-work group survey in a link that will be provided following the work group, that would be greatly appreciated. With that, you are welcome to share your presentation, Thomas. Thanks for being here.
Awesome. I'm going to share my screen and get started. Thanks for having me. Like Chelsea said, or Christy said, excuse me, I'm Thomas. I use he, him, his pronouns, and I'm the Head of DEI Development at University of Michigan Health West. Can everyone see my screen okay?
Yes. It looks like
here?
Yes.
Looks great.
Okay, wonderful. So I'm just gonna do a brief 30-minute presentation on kind of our journey at UMH West. When we really started focusing on creating a SOGI inclusive culture, and I'll define what SOGI means here in a second. This was really started back in 2018. I joined the organization on this initiative in January of 2020 on a contract basis, and then joined full time in October of 2020 to really, as the organization was preparing to launch SOGI data collection in EPIC, which is the EMR that we use. With that, we wanted to do a really comprehensive education and just kind of foundational understanding campaign so our staff and patients were ready. In the meantime, if you have any questions, feel free to type in the chat or I'll answer them at the end. Just like to throw some caveats out there. I don't know everything by far, especially within this realm of learning. Things are evolving and changing a lot, and they continue to evolve and change. So I'm constantly learning. Feel free to ask any question that you have. There are some spaces or some folks that we don't ask questions for, because for some people it's not their job to educate us. But in spaces like this, that's what I'm here for and others are here for, so feel free to ask questions. I always challenge people to be more curious and less certain. It opens us up to empathy and to what we don't know, and making sure we're getting out of a space that I absolutely know. Approach this content, if possible, from a perspective of what can we do instead of a space of scarcity, especially now in healthcare settings, like we don't have enough. And I totally understand that, believe me. I know that we're all in that space, but what can we do given the resources and that we have, the resources we have. And just, I'll refer to the rollout a lot, and that was really just the turning on of SOGI data collection, the SOGI data collection module in EPIC. So when I mention the rollout, that's what I mean. Just want to throw out a caveat. We use this presentation a lot. It was originally designed for a Baylor Institute workshop we did a couple of years ago. And so I'll go through some of it kind of quickly. That's not so relevant, but you'll get a copy of it. So if there's anything I go through quickly that you want to see, you'll get a copy of this presentation. Just a little bit about UMH West. We're an affiliate organization of Michigan Medicine, so University of Michigan Health in Ann Arbor. So about 208 licensed beds, 3,000 employees, about almost 1,000 contracted employees. 6 employee resource groups now, about almost 800 nursing staff now, level 2 trauma center. We were 2022 best and brightest to work for, and we were best of the best of large employers in West Michigan, both last year and we just found out this year as well. And then in 2022, we were ranked by the HRC Healthcare Quality Index as a top performer. And so we're currently submitting all of our paperwork for that now. We'll talk a little bit about the parameters with that here in just a little bit. A little bit about the Department of Diversity, Equity, and Inclusion. Our mission is to boldly prioritize and meet the needs of individuals and groups across different backgrounds and lived experiences. And our vision is to create a culture that ensures that our entire community can achieve its highest level of health and wellness. When Dr. Booker's our VP of DEI here at UMH West, we wrote this mission and vision statements about 3 years ago now. And we purposely wanted to point out the word bold, and we wanted bold to be in there because this work is hard. Sometimes we need a little courage to approach this work, and we'll talk a little bit about the culture shock of work, especially when it comes into the SOGI realm, especially in 2023, as we see a lot of polarizing rhetoric and conversations happening around SOGI inclusive care, especially gender affirming care for adults and children. Just to do some level setting, so you know what I mean when I say some words, if you don't already. SOGI stands for sex orientation, gender identity. Gender identity refers to a person's internal sense of gender and is distinct from sex orientation. So I like gender identity is a cognitive psychological development within our brain and is not determined or exclusive to any biological anatomy that we may have. Sexual orientation refers to a person's emotional and or physical attraction to people of the same gender, different gender, or others regardless of gender, or sometimes its lack of romantic attraction, intellectual attraction. So again, there are a lot of caveats when considering aspects of sexual orientation, gender identity. Sex. There are a few different facets of sex. When we say sex assigned at birth, it's really whatever was put on that birth certificate. And in our society, that's based on a biological anatomy. So really what the doctor or nurse, whoever's in the room, sees between an infant's legs. Usually that's what goes on a birth certificate as sex assigned at birth. Legal sex is usually what's on a birth certificate or passport. That can be in the state of Michigan very hard and expensive to change. So sometimes legal sex doesn't always align with gender identity or pronouns just because of the barriers in accessing as far as cost and just acquiring legal counsel. Sometimes there's a psychological or psychiatric component to it. So there are a lot of barriers there. And then gender expression is just the way someone expresses themselves outwardly. So what you can see, which again, one of the most important things to take away from this is that none of these are determined or based on the other, right? All of them can live independently of one another and can be fluid. So if you take anything from this slide, that is it, please. I like to start with this timeline really for a couple of reasons. In 2018, Metro Health, we were Metro Health then, wanted to turn on the SOGI data collection module in Epic. And our chief human resources officer at the time was like, hey, I don't think our organization is ready for this. So we really need to do some really comprehensive planning around this to make sure our organization, our staff, our physicians and APPs are really ready to do this work. So it was delayed in May of 2019. The Department of DEI at Metro Health was established with the hiring of Dr. Rand Booker, who's our VP of DEI. Some other stuff, but what I like to point out is that we didn't really launch or go live with SOGI data collection module until November of 2020. So almost 3 years after the initial, hey, we should just do this. And I like to point that out because while we may want to, while it is a good idea to do it, sometimes it's worth the wait to then say, hey, we need to wait because our workforce needs to be ready to do this if it's going to be done right. If it's not done right and you turn it on well-intentioned, it could end up doing more harm than good to your patients. And then depending on how you're integrating staff, your employees as well, because they're the ones interacting with your patients. So I'd just like to point that out. While we want to do this work, we do have to invest and make sure that our workforce is ready too. The why is probably the biggest piece, so the why as to what motivates us, why do we do this, why is SOGI data collection and SOGI inclusive initiatives so important? For us here at UMH West, our mission is to relentlessly advance health to serve West Michigan. Our vision is that our innovations change care and our care changes lives. And really, this work aligns with that, as including our values, which include caring, innovation, inclusion, integrity, and teamwork. So this work infuses into all of that, but especially that inclusion and belonging piece. As well as it promotes optimal health and well-being of all of our patients, including the vulnerable and underserved. It increases access to employment, satisfaction with employment, and quality of employment for all people. At this point, just for reference, we were, at this point in our presentation, we were designing this, we were also talking about the employee side of some of our SOGI initiatives. Increase access to care, satisfaction with care, and quality of care for all people. And then identify needs and eliminate disparities in patient and employee populations. And that really ramped up when our Office of Health Equity was created in July of 2021. We were able to partner with them a lot more, us doing a lot of the internal education, resource development, employee development, and then health equity really carrying out a lot of the patient-facing, reducing obstacles to care pieces of that work. I like to point this out. This is based on a Robert Wood Johnson graphic that I'm sure you've all seen. If you haven't seen it, I'd be surprised. We just, our marketing team, liking U of M colors as much as U of M likes its colors, wanted to put it in, wanted to redesign it. So it's basically the same thing, just in our branding. But really talking about how the difference between equality and equity and why this work's important. Sometimes when I do this presentation, depending on the time that I have, I like to start it with all patients aren't created equal. And whenever I do that, I get some looks in the room because people think that that's my job, is to say all patients are created equal, or that's what my end goal is, to that all patients are created equal. And really that would be a very misguided goal for the Office of DEI, but also for an organization doing inclusion work, because we know all patients aren't created equal, depending on a lot of intersecting identity points and demographics. Someone could face multiple obstacles and barriers in accessing quality healthcare and achieving their highest level of wellness. So it's not so much that we're striving for equality, but definitely equity. The difference there being equality, everyone has the same. So you'll see in that top graphic, that doesn't work. And that bottom graphic, equity, is everyone getting what they need. So you'll see at the bottom graphic, everyone's able to participate within the context of their own abilities, what they have access to, what they're able to do. Want to touch really quick on who we brought to the table when we started this work. It was a big project. It was an organization-backed project. We had 2 project managers from our Office of Project Management. You'll see all the work groups and all the teams we had working across the organization to do this work. At the bottom of this slide, you'll see all of the different departments involved. The next slide, just some of the role descriptions that were at the table, and really everyone here was actively involved in this. And really I was, and when this started, I was in as a contracted community member, so a contractor, helping inform this work, and then took some of this work over when I was hired in October of 2020. But really, it takes people from across the organization. This doesn't just live in DEI, health equity, your medical group. You'll see EVS, nutrition services, registration, social work, our nursing education team, of course, marketing, patient access, patient financial experience. Really, I think it touched every piece of our organization. Preparing for the rollout, this is where we spent the most time. So this is where the pause came from 2018 to the end of 2020, and this is where we wanted to do the most work. This is the most critical part of your process. Your staff, no one is inherently good at change, especially change like this that is deeply embedded in the way we learn to interact with people, the way we learn to make assumptions and to visualize people in our head. So when we hear a name, is that name a male name, a boy name, or a girl name, right? When I see someone wearing a dress or a skirt, my bias is I am told based on the way growing up from multiple different sources that I should register that with a female, she, her pronouns, right? And so there's a long line of things that automatically start checking boxes for me, right? And this really was changing all of that. So it wasn't just saying, hey, collect this data. There had to be this understanding behind it. So that's why it's so critical. What we really wanted to focus on in the beginning was creating avenues for bidirectional discourse regarding the introduction of SOGI data collection. So making sure people knew that when I'm anxious about this, and people were anxious, believe me, they knew who to contact. And so whether it's was their leader, so their direct leader prepared to answer questions, was their upline leader, so their director or VP or C-level executive ready to answer those questions? And were we as a department ready to answer those questions? And did they know how to access us, given that we were still a relatively new department, which really had just, this had been our main focus since its inception was this project. And then also, of course, creating resources for UMH West staff to respond to patients, but also some patient resources, which we'll talk about here in a minute. This will look different for each organization. I don't want to get too detailed in what this looks like because I know every organization is different size, has different resources, has different access to different things. So I don't want to say, hey, do this when someone knows that there's no way they're going to be able to do this. But really just within your own context, how do people contact you? How do they know they can contact you? And if that doesn't exist, how can you create it? And we'll talk about how we did that. Proactive dialogue. Don't wait till the rollout to start the dialogue. Start having the conversations. We had a few town hall meetings. We recorded videos. Our CHRO did one. Our CEO did one. Our VP of DI did one. I did one. We released them kind of chronologically over a span of time. Our CEO did some. He integrated them into his town halls. We were doing COVID town halls then, so he integrated them in. He integrated this conversation into some of those. We created the SOGI at UMH West email address, and then also created DEI check-in conversations, which was built into our learning management platform. Someone could go on there, request, and say, hey, I have questions about this. I keep hearing about this SOGI thing. Can we just talk about it? Because I need to know more about what it means. Also, we had a lot of conversations about this doesn't align with the way I was brought up, my personal ideals, my religious ideals. How do I reconcile that? You know, like, how do I do this? And so we were having a lot of those conversations. We wanted to make sure people knew exactly how they requested these conversations. They knew that they were low risk. We didn't document anything. It wasn't reported to HR that we were having these conversations. Of course, if some things were said, right, we have to report some things, but very rarely was that the case. But wanted to make sure people knew there was a way for them to contact us if they had questions and if anxieties were high. Creating a organizational foundational knowledge. Does everyone have the same understanding of the what and why? Internal glossary of terms and the details and small stuff matters. I'll get into that in just a minute, but when I say the detail and the small stuff matters, I don't know if anyone from our UMH West team is on here that was part of this process then, but I think we probably had 2 meetings about whether or not we wanted to say LGBTQ, if we wanted to say LGBTQ+, if we wanted to say LGBTQIA+, like we probably had 2 whole full meetings about what we wanted to do, what was considered culturally competent and culturally appropriate at the time. When we started talking about pronouns, we say personal pronouns, chosen pronouns, right? Like we spend a lot of purposeful, intentional time. Some might say too much time looking back on it, but we did the work. And so the detail on the small stuff do matter because it matters to the people that it's impacting. And then preparing leadership. So is your leadership prepared? Can your senior leadership, organizational leadership tie SOGI data collection in with your mission and vision and values. So at the very least, right, your mission, vision, and values should be your North Star. So that should be what, if they can't respond to anything else, right, they don't know anything, is it tieable to your mission, vision, and values? And it absolutely was to us, because we can't relentlessly advance care if people don't feel like they belong, included, safe in our spaces. We also have inclusion as one of our values. Be prepared for questions and accountability. And then Dr. Han, who is our president and CEO, he did a video specifically about SOGI data collection, why it was important, that we released, and it's still available. It's on our SOGI resource page on our internal intranet. We also created MEL. It used to be called MetroMel, and now they're called MEL. We wanted it kind of an anchoring mascot, right? This was based off the genderbread person. If you've ever seen the genderbread person, it is a tool used across really schools, created it, but we wanted something very similar to kind of always reference, but we wanted to make sure we weren't stealing copyright from anyone. So we created MEL, who they are our own kind of mascot anchoring point. So you'll see MEL kind of represents the different aspects of SOGI. We created MEL a name badge. MEL is gender neutral, so that we were able to tie that into conversations about gender neutrality and gender neutral pronouns. And then we kind of always had something to reference, and we didn't have to make someone up. We didn't have to make a patient up. We didn't have to try to search for a patient, a test patient. We always had MEL. MEL has a fake chart in Epic, so we can go into Mel's chart. So it was easy for us to kind of create that, and our marketing team was great with this. Just a couple of the resources we created. Happy to share this with anyone that's interested. This was kind of the what and why. Why are we doing this? What is it? When is it going to roll out? It rolled out on November 20th, 2020. This is what you're gonna, this is the patient facing. So this is what we gave to patients. It was out in lobbies. It's still out in some lobbies, depending on the questions that folks are getting. It's basically to our patients, why are we asking this? Why is it important? Especially now in this part of 2023, we're kind of having to reprint some of these as we're getting some questions giving social and political rhetoric that's happening in our country and in our area. This is the backside of that patient-facing flyer. This is really towards LGBTQIA+ patients. So we really want to say, hey, do ask, do tell. We want to make sure that you're comfortable having these conversations with your provider. If you're not, you're within your rights to request a new provider. This is how you can do that. Or if you feel like maybe your provider is taking steps that are inappropriate or that you're not happy with, you're feeling unsafe, this is patient relations, right? So we really wanted to be as transparent. We're holding ourselves accountable. That's how we made sure we weren't being performative, and we'll talk about performative in a second. Being performative with this work, so just stopping at fancy logos and t-shirts. You'll see I'm wearing one, flags, pins. We didn't want to stop there. We had to make sure the other half of performative allyship is accountability and commitment. And so this was how we did this from a patient-facing side. A bunch of practice scenarios we created for our staff that are available on the LMS. This is the pin. You'll see I have one on my badge. They're everywhere. I have a box of 1,000 of them that just came in. We also created these cards that kind of explain the colors. We wanted to make sure there was an educational component. So again, not just saying, here's a pin, it's pretty, put it on your badge or on your bag. Here's the educational component as to the why we're doing this, and to make sure people could speak to it if in case anyone asks. We also did a glossary of terms, which I referenced. I'd like to point this out, 54 terms and concepts, along with 6 outdated and potentially offensive clinical terms, which is still actively downloaded a lot. This is a repeat of that Foundations of SOGI, but this is a handout that we have. It's sitting in our HR lobby. People can grab it, but this is widely circulated. I will bring this with me if I'm having a SOGI-related conversation. Again, some of the stuff we did, we created these "You Belong Here" decals. So they, in early 2021, we had these printed. They're like window clings, and they went on every door in our entire health system. So at the hospital, the professional building, all of our outpatient offices, every outward facing door has one of these, and not just clinical doors. All of our admin offices, HR, DEI, volunteer services, community outreach, quality and continuous improvement, everyone has them. It was a directive from our president and CEO. You'll see pronouns on signatures. You'll see our pronouns on our badges. This is a table in HR, so people can come up and get pronoun stickers for their badges. See some stickers we created, again, that handout, and again, that pin card with some education. So really doing a lot of this performative work, right? So this is, when I say performative, it's the pretty things. It's the things that look nice. It's the things that people can see. And those things are great, right? That shows people, especially LGBTQIA+ people, that you're putting in the effort. However, you can't stop with performative actions, right? You cannot stop with the pretty things, the things that are easy to do. This work is not easy. You have to be bold about it, right? So then we started looking at our policies, right? We said, if we were going to do all this performative work and we have these pretty logos and we're spending money on all this stuff, we have to do the work when it comes to our internal policies and procedures. So you'll see this is just a couple of them, but a lot of the big ones. We edited all of our policies that had any of that kind of like boilerplate non-discrimination class language to include gender identity and sexual orientation. They all had to do that. That was updated on our website. Anywhere that kind of blurb was, we made sure gender identity and sexual orientation were included there, both of them. So you'll see we edited those. We edited the definition of family for visitation to expand. I think it says something like anyone with a deep emotional connection, really to be inclusive of someone who may not be related, they may not be married, right? We expanded our definition of family based on some recommendations by the Human Rights Campaign, but really made these as SOGI inclusive as possible. We also are in the process. It's kind of a long process, but it's evolving. From that point on, anytime a policy was up for review, it goes to the owner. And so there was a directive from there that any policy with gendered language now has gender neutral language. So instead of he, she, we just put they, right? There's really no reason for policies to have gendered language unless you have a policy for female identifying individuals specifically. If you do, that's perfect, you should. But that doesn't also necessarily mean that they use she, her. So, but that very rarely happens, but that's been going for about 2 years now. So we should almost be through all of our policies, as most of our policies, all of our policies are only good for at the most 3 years. So really just showing that commitment piece and that piece beyond performative allyship. Key considerations, and there's a lot here, and I'll go through them kind of quickly. The ones that I want to point out are just the two with the red stars. Workflow is something that we didn't pay enough attention to. It's something that we really focused on resources, making sure people are ready, training. We didn't put a lot of thought into who's saying what, how are they saying it, when are they being asked. And when we really started reevaluating in January 2022 for SOGI 2.0, that was one of the biggest gaps. And then importance of scripting and practicing, not just giving someone a script, but actual like muscle memory. So people are like, I get it conceptually. I don't really understand how to ask and how to respond if someone's like, why are you asking me these questions? People got nervous, they got anxious. So we've been building and working on very specifically with different sites, saying we'll go in and we'll practice with you, right? So if you're an MA asking these questions once someone's roomed, I will go in and we'll have a room. I can be the patient. You can go through this workflow and you can practice as many times as you want. And sometimes I'm there to ask the question, I don't really know why you're asking this question. I'm uncomfortable, or why are you asking these questions? We got a lot of responses from our patients about political alignment. Alignment went with U of M, right? Like we got a lot of different reasons as to why we're asking these questions. None of them the benefit and wellness of our patients. And so just making sure our staff were prepared to answer that. I'm comfortable. Creating a foundational understanding. We created a 5-module e-learning that was required of all staff by November 1st, and then is required still of all of our staff within the first 30 days of hire. So you'll see Metro Health on a lot of these. This is clips from when it rolled out. This is in the process of being remodeled at the time. My next meeting is going over this e-learning, but you'll just see some of the slides on this e-learning, what we covered. I'm happy to send this PDF to anyone that is interested. We had a 93% completion rate, which within our organization, at least, that was kind of historic to have 93% of people complete required training without having to do any follow-up. We just had to do the follow-up with the 7%. So it really showed us there was a very genuine interest and and hunger for this information, that people wanted to know it and were curious about it. Again, I can send this PDF of this e-learning to anyone that would like to see it. We also launched a SOGI curriculum. So this is workshops that are available through the Department of DEI. It's kind of step by step. So we start with Foundations of SOGI. That's one of our DEI core curriculum items. Pronouns 101, and then LGBTQIA plus community actions and interactions in healthcare, which really talk about statistics, disparities in healthcare, interactions in patient rooms, and what can happen, how our actions impact whether someone feels safe, whether they go back, and how that leads to chronic illness, chronic mental health issues, and how that can spiral, especially generationally within a community. The rollout's really quick. That was just turning on. We turned it on November 1st. This is what it looks like in Epic. If any of you use Epic and have your SOGI data collection or the SOGI pieces turned on, this is what it looked like. This is the SOGI smart form. So this is where folks go in and put in that information, which then feeds the rest of Epic. So notes, the storyboard. The storyboard is this right here. It's on the side of every patient's chart. So you'll see female pronouns. It'll list all the pronouns you put in there. So if I click 4 of these, it'll list all 4 pronoun sets. What I really like about it is that it highlights if it's something that is changed or different, right? So if someone's gender identity doesn't align with their sex assigned at birth, Epic will highlight it and put this little eye there. So then someone knows that it may be something to pay attention to, especially when we think of social determinants of health and how LGBTQIA plus queer people face significant barriers both socially and in healthcare spaces. So the physician, APP, MA, nurse has that information when working with them. It gives us a certain level of empathy. Getting towards the end here, I just wanted to show you some of the feedback we got. Call list responding to culture shock. We got a lot of feedback from patients, a lot of really good feedback, and we got a few that weren't as supportive, right? And we had to be prepared for this. But for the most part, we got overwhelmingly supportive feedback from our patient and employee base. But I think it's in realm of transparency, I think it's important to show you what you may see, especially in 2023, right? This was 2021. So you'll see like our decision to buy the Progress LGBTQ flag, which is we put it up every June. You'll talk about our alignment with political ideals, a distrust in us, right? So how can I trust mental health to give me the real scientific facts that messes up something obvious and so basic, right? There's obviously a disconnect between what we think is scientific facts here at our hospital and what they do. And the most important part here, and which is why I love our patient relations department, is that there's no one size fits all response. Thank them for feedback, validate their feelings. Everyone's feelings are valid, right? We're not going to change the way someone feels because that's the way they're interacting in the moment. Make it a conversation about patient safety and our organizational commitment to equitable care for all and why it's important. So using some of that social determinants of health data, and we worked with our patient relations department to give them some of that data. And if and when the conversation turns political, remind them that a person's identity isn't political, and our decisions to make sure we are creating equitable and safe spaces for everyone isn't politically motivated. It's still rooted in our organizational values of inclusion and care. And again, recognize when it's time to preserve the patient relationship, right? We want to keep them as a patient without jeopardizing your organizational commitment to inclusion. There are some people you're not going to change their mind, right? And that's not our job. It's our job to help them understand why we've made the decisions we have. So these are just some of the responses our patient relations department came up with that they shared with me. And I wanted just to share with y'all that they were then responding to these folks with. And it wasn't just patient relations. We had some donors reach out to our foundation. I had our director of our foundation say, hey, what do you think I should do? And we based it a lot in this. And again, that's why I love where I work, because there are some places where a donor's opinion may matter more than our willingness to do this, and that's okay, given whatever your prerogative is. And at UMH West, we weren't willing to do that because it jeopardized our integrity as an organization and a healthcare provider. And again, I can share this. You'll get this slide deck, so you'll see some of these responses. And really, just as we're moving forward, and some of these things have already taken place, but we have a Pride Employee Resource Group. We have a lot of community partnerships with a lot of different organizations, including the LGBTQ Center. continue learning and development, so that SOGI curriculum. We have a lot of different guest speakers come in, some folks in the community, some folks from the east side of the state, workshops, live panels, social events, and then we're constantly evaluating and figuring out how our learning content and resources can evolve. And then just some tips. Normalize the capturing of SOGI data collection, enhancing DEI learning, identifying and addressing clinical considerations. A large part of SOGI 2.0 was the clinical side of it. So making sure our clinicians felt comfortable doing this, things like organ inventory, was that being captured, strengthen processes. If you're not participating in the the Human Rights Campaign Healthcare Quality Index, I highly suggest you do it. It's a little bit of work your first year. There's no need to place, but you get such good feedback from them, and it kind of gives you a roadmap. It's a built-in roadmap, and it helped us so much our first year. And we scored a 90 our first year, and I think I was expecting to score like a 55, right? And we did way better than we thought we were going to, which really spoke to the work that was already being done before I and Dr. Booker even came around. And then continue creating a healthcare environment responsive to the needs of this community. I went through that very quickly, and so I just wanted to make sure that there was time for questions. This is our contact information. I know that Chelsea and Christy have my contact information, which you're welcome to share. But again, wanted to, and y'all will get this slide deck, so you're welcome to look through that and reach out if you have any questions, or if you have any questions now, I'd be happy to answer. Thank you.
Thank you so much, Thomas. That was a great presentation.